order from President Trump. We'll, of course, follow any details on that and bring that to you as they come into us. Now, on to another story here in the U.S. today. Medical experts are reacting with alarm after President Trump announced new health guidelines that pregnant women should not take the painkiller acetaminophen. This despite researchers saying there is no conclusive evidence linking autism and the over-the-counter drug, which is known as Tylenol in the U.S. and paracetamol around the world. Mr. Trump repeated a number of debunked myths during the announcement, such as a link between childhood vaccines and autism. He also said a number of vaccines administered together to children in the U.S. should be administered separately, quote, based on what I feel.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that, acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
With me now is Dr. Emily Smith, Chair of Global Health at the George Washington University. Dr. Smith, thank you so much for joining us. First of all, what did you make of what we heard from President Trump there, what he's saying about Tylenol in pregnancy is not good?
Yeah, it's surprising to hear because all professional societies, the Society for Maternal Fetal Medicine, the American College of Obstetrics and Gynecology, the Royal College of Obstetrics and Gynecology, the European Medicines Association, all of these professional societies and regulatory bodies affirm the safety of acetaminophen or Tylenol or paracetamol in pregnancy.
That being said, some studies have shown a link between some cases of autism and taking paracetamol, Tylenol, as you said, in pregnancy. I mean, can you tell us a bit more about why this is inconclusive at this point?
Yeah, so there have been a number of studies that have shown that, and an expert review by these bodies and researchers like myself confirm that these studies aren't the highest quality, that they suffer from some problems. So studying this kind of question in observational data, like remembering about Tylenol use, is really hard. Why is that? There's a lot of different reasons, but for example, it's hard to get the medication away from the illness. So for example, when you have a problem that requires you to use Tylenol, that also has risks for mom and for baby. So you have a headache, you have a fever, you have an infection, and that's what causes you to take Tylenol. That can make it look like in an analysis that there's some link between the Tylenol and this bad outcome, when in fact it's actually related to the problem the reason you were taking Tylenol. This and many other issues make this kind of a challenging issue to study. And so that's why we say that researchers and experts have to kind of rate this evidence and see which are the better quality studies and how certain are we about this. And so hence the conclusion, yes, you can find a study published that shows a link between Tylenol and autism, but the evidence overall shows no link.
What is your concern from the public health perspective when you see new guidelines like these delivered?
Yeah, I'm concerned for a number of reasons. First of all, I hate to see it when we blame women, when we blame pregnant people for causing problems with their kids. So that's first of all. And second of all, it is important to treat pain and to treat fever in pregnancy. So a fever in pregnancy is related to miscarriage, to birth defects, and to preterm birth. Pain is related to depression, anxiety, high blood pressure. And so kind of the problems that you have that might lead you to take Tylenol are also important complications in pregnancy that need to be treated.
I do want to ask you a bit about vaccines. We know that the Health Secretary, Robert F. Kennedy Jr., is someone who's very skeptical of vaccines, and we've seen this administration acting on some of that position. And we saw Donald Trump say today the hepatitis B vaccine, he said there's no reason to give it to babies. Can you tell us a bit more about this vaccine schedule and why it is considered important, or why maybe it should be put into question?
Yeah, the birth dose of hepatitis B has been so important here in the United States, such that at the moment we've essentially eliminated mother-to-child transmission of hepatitis B. And so that's one of those things where it feels a little confusing right now because you say, oh, there's no cases of this. There's no cases of this because we've implemented highly successfully the birth dose of vaccination of hepatitis B.
Just one last question on the vaccines there. Do these changes, you think, have a direct impact immediately on people, on the public health of the U.S.?
Yeah, I think the immediate impact is that it's confusing to people, right? So
Okay, I
the
see.
immediate impact is that people aren't sure whether or not to get vaccinated. And that causes a problem that allows these infectious diseases to start circulating again and start making kids sick again.
Okay. Dr. Emily Smith, Chair of Global Health at the George Washington University. It's great to have you in today. Thanks so much for joining us.